sorry for the delay there. My name is Mark Prissel. I'm a fellowship trained foot and ankle surgeon with Orthopedic Foot and Ankle Center in Columbus, Ohio. We're going to be talking about ankle arthritis and some of the applications and treatments that we can do for that. So similar to what's been talked by the other presenters and for other joints, when should you see a specialist? It's when you really have limitation in your desired activities, and when some of the very similar described either self-cares or cares that would have been recommended by your primary care physician are not providing appropriate relief. These are over-the-counter medications, activity modifications. In the foot and ankle, it can be modifying or changing shoe gear, using a variety of different type of bracing, as well as additional modalities. There's no real particular restriction on time when you should see a specialist. We see some patients that come to see us when they've had pain only for a few days or weeks. And then some people have been dealing with this for several years by the time they make it to us, and they've been interacting with their primary care physician or seeking other options for treatment prior to that. But if you're concerned about your pain and your pain isn't improving, I think that's really the time to see a specialist and somebody that's experienced with the specific area of your body that's causing the problem for you. Orthopedic Foot and Ankle Center is the largest multidisciplinary foot and ankle subspecialty practice in the country. One thing that's a little bit different about our practice is our entire practice is focused on foot and ankle care. Most orthopedic practices have specialists that focus on various areas of the body. With ours, we're highly subspecialized and focused only on the foot and ankle, which makes us a little bit different. When it comes to treating ankle arthritis and doing ankle arthroplasty or ankle replacement, we're one of the highest volume total ankle replacement practices in the country. We have locations throughout Central Ohio, and we have multiple fellowship trained foot and ankle surgeons who are trained and experienced with a variety of different total ankle replacement systems that are out there. And so when we're looking at the causes of ankle arthritis, what about it is similar and what about it is different to others? One of the main causes for ankle arthritis is chronic instability of the ankle joint. Those who are loose jointed, people who have struggled with multiple prior sprains, either from athletic activities or just general walking activities. Sometimes people have difficulty with multiple sprains over a lifetime that they didn't really treat 10, 20, 30 years ago. And over time, that weakens the joint and causes the cartilage or the lining of the joint to rub against each other, and it can wear the cartilage down more rapidly. Inflammatory arthritis, such as rheumatoid arthritis, is another problem that can cause ankle arthritis. And then people who've had prior trauma to the ankle. One thing that's a little bit different with the ankle joint is it's not as frequently simple wear and tear. The number of steps you take in your life doesn't necessarily cause your ankle joint to wear out, so long as you have good stability to the joint and you haven't had prior trauma to that joint. So what treatments are available from the non-surgical standpoint? It's very similar to what was talked about by the other presenters. Modifying activities, using those anti-inflammatory medications, changing your shoes, trying to use a brace of the ankle. Injections are also an option. And similar to the other joints, corticosteroid injections tend to be the gold standard. The gel type injections are not FDA approved to be used in the ankle joint. Some people do choose to use them off label, and there's limited evidence on PRP in the ankle joint as well. What are the indications to consider a more definitive procedure for your ankle? Well, first off, you have to have arthritis in the ankle. And then we assess as well what's going on from a deformity standpoint. When you look at the foot and ankle, there's many small joints that are just below where the ankle joint sits. And sometimes those joints may have problems, or the bones within the foot may have problems that would make it so that the ankle joint may not be as successful. So in some instances, we have to correct a deformity or problem in the foot first before we would move forward with an ankle joint replacement. Some of that stuff can happen at the same time, and you rely on your experienced surgeon in total ankle replacement to help you make those decisions if it's safe to do it in one surgery or if it would be a better choice to do it in two surgeries. We look at what's going on at the neighboring joints. Again, there's many small joints in the foot that can be impacting what's going on in the ankle, and also what's happening at the knee can influence what's happening at the ankle as well. We look at the age of the patient. Generally, when we're doing ankle replacements, historically, it's been those that are 50 years or older. As we've seen improved success with total ankle replacement, that age restriction is starting to move down, where now if you're a little bit younger and not overly active, you may be an appropriate candidate. We do take into consideration BMI and weight as well. And as with any joint replacement, you want to ensure that there hasn't been a prior infection or that there certainly isn't an active infection in that joint. And then to have normal sensation. Neuropathy is a disease that can cause the nerves to not act appropriately, and it can be somewhat common in the foot or ankle or in the more distal extremity as you get farther away from where your spine is, and that can have some impact on how successful a surgery can be in the ankle joint. This is a little different compared to the other joints that we talked about. An ankle fusion, where we actually look to anchor two bones together, for certain patients can be an appropriate management strategy for ankle arthritis. It can be a good procedure for pain relief. And in some procedures, or in some circumstances, it may be the best option, or really the only option if they're not a good candidate for total ankle replacement. The downside of an ankle fusion is the neighboring joints right below the joint or right below the ankle joint or in front of the ankle joint. It can accelerate arthritis in these joints because the ankle joint isn't able to move anymore after a fusion is done. And generally what we're seeing in terms of the literature is if people are an appropriate candidate for a total ankle replacement, the outcomes for them are leaning toward you probably should do a total ankle replacement if they're a good candidate rather than an ankle fusion. But again, for pain relief and in certain patients, an ankle fusion is the appropriate option. Understanding deformity, like I said, because not only can there be deformity within the ankle itself, there can either be deformity above or below it. And at our Orthopedic Foot and Ankle Center location, we have a special type of a CT scan called a weight-bearing CT scan that allows us to assess these deformities while people are standing. And that can help us understand really what components of the deformity are influencing what's happening at the ankle joint. It's an efficient process. It's an open machine in a reasonable sized room. And so it's a non-claustrophobic scanning experience. This allows us to get more detailed imaging and provide best patient experience and outcome. And again, it shows those deformity in stance or weight bearing. And then there are certain implant systems that have protocols that can create, based off of these types of scans, custom cut guides for the ankle replacement to help us execute the procedure on the day of surgery. So we are able to do some of our planning for the surgery before the surgery actually happens to limit the amount of time that you're on the operative table and the decision making that's needing to happen at the time the surgery is performed. When we look at implant types, very similar to what's been described for other joints, it's essentially a combination of metal and specialized types of plastics. And many of these are resurfacing type implants trying to restore as much bone as possible. Although in the ankle joint, when deformity is present, sometimes we use a stemmed device that has components that go up into the shin bone to help provide more support and stability. So for surgery and then after surgery, this, similar to the other joint replacements, can often be performed outpatient, and that tends to be our preference. So long as it's appropriate with your insurance and your medical health, these tend to be performed outpatient. Similar to what Dr. Westerheide said, as of 2024, some of the insurance laws have changed, and total ankle replacements are now more frequently able to be performed outpatient than they were previously through ambulatory surgery centers. The surgery typically takes an hour or maybe up to 2 hours, depending on the complexity, and it is done under a general anesthetic with, like Dr. Westerheide said, similar to the shoulder, with a regional anesthetic block to help control your pain afterward. And when it's done outpatient, to allow you to get home and start taking your pain medicine before that nerve block would wear off. What's different about a total ankle replacement is typically we have to keep you non-weight bearing for a period of time. In our practice, generally that's about 4 weeks. That isn't so much for the bone and the implant to bond together as it is for the skin to start the healing process and the early phase of the implant to start to seed where it's supposed to. We use cold therapy to help control edema and elevation as well in those first few weeks after surgery. We start physical therapy typically at week 4 after surgery. And then once patients are able to put weight on the foot, and they often go into a walking boot, which they're in for another 3 weeks or so. And then we may use bracing if it's needed to help provide additional stability up until about 3 months after surgery. That isn't always required, though. In terms of restrictions after surgery, really, we're trying to avoid those high impact loading activities that others have talked about as well. It's really running and jumping that we're trying to avoid afterward. I have my ankle replacement patients that play golf, doubles tennis, pickleball, skiing, surfing, cycling. Those types of activities tend to be okay. But again, focusing on the lower impacts. And then we do see our patients annually to monitor the implant. Complications and risks. In the short term, we're concerned about infection and wound problems. And so we see you regularly and keep the weight off the foot for the first few weeks to help minimize these risks. Long term, it's pain, implant loosening, subsidence, or wearing out of that plastic liner. Like Dr. Yergler had said, the technology within the plastics and the components has improved substantially. So some of that's a little bit more historic, and the prognosis and long-term outcomes of these implants has significantly improved over the years. This is a question that sometimes patients have, or sometimes we have to help redirect them. Is if you have a knee problem as well, or if you have arthritis in your knee, especially if there's deformity present in the knee, you're generally going to need to get the knee addressed first. And so you may come see us as a foot and ankle specialist, and we may say, it's actually not the right time to have your ankle done. We need to help refer you to a OrthoAlliance partner practice who specializes in knee arthroplasty to get that corrected first, and then they would send you back so we can manage the ankle thereafter. So that's a common thing that we see, and something that you should be aware of is if you have arthritis in both places and you're unsure which one to correct first, general principles would say that you should do the knee first and then your ankle thereafter. Just a couple quick examples of ankle arthritis. Here, the image of the right side, which is on the left-hand side of the screen, shows that joint space narrowed, and on the opposite, there is what a normal ankle joint would look like that does not have arthritis from the same patient. Here's what the side view looks like, where you see the big spurring in the front and the back, and really bone-on-bone arthritis through the entire level of the joint. And so here's an example of the special CT scan that we get that looks at what's happening at the knee and the ankle to help us build the guides that place the implant in the appropriate position in the most efficient way possible during the surgery. And then afterward, what it looks like with the ankle joint, you can see the space there where the plastic liner is in between. Here's an example of a case that has, I would say, mild to moderate amount of deformity, where there's more tipping of the bottom bone of the ankle joint called the talus, and the joint is more worn out on that side. There is also some deformity in the foot in this case, and this was a patient that had pain both at the joint below the ankle as well as the ankle. And so the ankle joint is crooked. And what we do with this is I chose to use a stemmed implant that goes up into the shin bone here. And because they had pain in the joint below, at the same time, we anchored those two bones below the ankle joint together to help provide improved pain relief at both levels of arthritic joints, one by doing a fusion and one by doing a replacement of the ankle joint. And by doing so, we improved the overall posture of the foot. That one I will skip over. It's a little bit more complex, but again, you can see that sometimes things need to be done in a staged fashion to help straighten everything out. And so from a final thought standpoint, if you have ankle pain, deformity, or arthritis, it's important to see a specialist to understand your options. Both surgical and non-surgical options exist, and experience matters. Thank you.